Hello, my name is Sue Lenihan. I'm the Lead Movement and Handling Advisor for Kenton Medway NHS and Social Care Trust. I'm a postbac graduate of Loughborough University's Ergonomics programme, Human Factors. Today I'm going to be talking about transferring a patient safely from a bed to a chair, both independently and with assistance. I'll start by describing the steps needed to help a patient stand from an electric profiling bed with the help of one carer. Then I'll move on to describe the steps to take when standing and mobilising a patient from a non-powered bed with two carers, then one carer, then independently. With any patient who has been in bed for a long period of time, be that days, weeks or even months, there are a number of important factors to consider before helping them up in order to reduce their risk of falling. The first consideration is their desire to get up. If the patient is willing and enthusiastic to get up, then that is great. But if the patient has been in bed for many days, they may be reticent. You can encourage by explaining it is a significant milestone in their recovery, helping them feel like they are making progress and helping them boost their muscle strength. But if they are in pain, you will need to attend to this first. Give analgesia and only attempt to transfer after at least 20 minutes. Also, it's a good idea to check other types of medication that may have any bearing on their ability to move from the bed. For example, antispasmodic medication for those with Parkinson's disease. Essential it is taken on time to be effective. You will also need to consider their physical strength. The patient needs to be strong enough to move, so carry out some physical checks. Ask the patient to bend their leg. Next, ask them to push their thigh against your hand, up and down, from one side to the other. Now repeat with their arms. Ask the patient to straighten their arms in front. Place your hands against their palm and ask them to push against your palm. Move up and down, side to side. The next consideration is weight. You should be aware of the safe working load and maximum patient weight of the bed. You'll find these in the user guide. You also need to be aware of the weight of the patient and the weight of the carers involved in any manoeuvre that adds weight to the bed. For example, if they sit on it. The total weight must not exceed the safe working load of the bed. For this video, we have calculated the total load and it is safe. In the NHS, falls are the most frequently reported patient safety incident, so it is important to assess the risk of a patient falling, particularly in older adults and those with dementia or delirium. Is there a history of falls? Do they have suitable footwear on? Are they anxious? Is there a history of postural drop of blood pressure? How high is the surface if they were to fall? According to the Royal College of Physicians, some 22% of inpatients' falls occur directly from the bed. In general, the lower the patient when they fall, the less they will be harmed. We can use gravitational potential energy to calculate this risk. Gravitational potential energy, or GPE, is calculated by multiplying the weight of the patient by the height they could fall from by a gravity factor, 9.8 newtons per kilogram. Researchers have investigated the difference in GPE due to a range of bed heights. Assuming a bed platform has a 14 cm mattress on top of it, when the total bed height is cut from 53 cm to 35 cm, the impact is halved, substantially reducing the risk of injury. In simple terms, this all means a patient will sustain a greater level of injury if they fall from a higher position than a lower one. So for patients at high risk of falls, a bed which achieves an ultra-low position helps to reduce the risk of injury from a fall. A bed height, mattress plus frame, which is ultra-low, for example 35 cm from the ground, will help reduce the risk of falls injuries and also means that nearly all UK adults will be able to mobilise safely from it. For mobilisation, if you are using an electric profiling bed, you can adjust it to a safe height for each patient. This is sometimes referred to as their popliteal height. Their feet are flat on the floor and heels, knees and thighs are at a 90-degree angle to the bed. A bed which can be programmed to stop at each individual patient's popliteal height removes guesswork and ensures that they are mobilising from the safest height every time. Getting up for the first time after lying flat for a long time may lead a patient to feel dizzy. So you'll also need to consider any potential loss of spatial awareness. This is normally done by a physiotherapist, but I'll talk you through how to check that. Ask the patient to sit up unsupported and look forward. Can they turn their head to one side without getting dizzy? Ask them to put a hand across their body and shake your arm. At the same time, can they move their head the other way and not feel dizzy? Another test is to ask the patient to roll over on one side. Can they do this without getting dizzy? Can they react appropriately to a command, for example, to bend their legs and reach their toes? If the answer is yes, their spatial awareness is good. If you are worried, you can practice sitting a patient up several times for a few minutes to check they do not feel woozy. If you feel that moving them out of bed is too risky, a physiotherapist should review. Now you are almost ready to help the patient out of bed. Just a couple of things first. Check the height of the chair. This must be the appropriate height for the patient. Too high and they won't be able to get onto the chair and the legs will hang, putting stress on their back, circulation and sitting stability. Too low and this will be uncomfortable and dangerous as the patient will feel like they are falling when they sit down. The correct height is one that matches the popliteal height of the patient. Length from floor to back of knee. This should be checked by an OT or physiotherapist before the patient is sat out for the first time. Finally, think about any walking or balance aids the patient uses, a walking stick, crutches, a Zimmer frame or roller frame. If you're going to use these during the move, they need to be close enough to hand to pass it to them as they come into standing. Now you're ready to begin. In order to sit a patient up from lying flat, first speak to the patient and explain what you are going to help them to do. During the course of the move, continue to explain what's next, giving clear instructions. Raise the patient to an upright position using the auto contour button. If you are using an electric profiling bed as illustrated here, this move will automatically bring the patient's bottom to the correct position in the bed from which to pivot their legs. Lower the knee break, then raise the bed to the correct height. If the bed's safety sides are not up, raise them on both sides. Adjust the bed to the right height for you. The top of the mattress should be at your umbilical height. Next, put on the patient's slippers or sensible standing shoes. Place a slide sheet under the patient's legs. This will reduce shearing as they move. Move to the side the patient will get out from. Lower the safety side down on this side. If the bed has a separate top and bottom safety side, keep the top one raised to help the patient when moving. As the patient sits on the edge, your hands are on the patient's shoulders for balance assistance. Then remove the slide sheet and use the controls to lower the bed until the patient's feet are flat on the floor. Remember, getting up after lying flat may cause your patient to feel dizzy, so when they sit up, they may need a moment to adjust. You can use an electric profiling bed to help a patient achieve an active standing position more easily. First, explain that you will use the bed to help the patient stand. You will do this by raising the bed and bringing them to a semi-standing position. You will be there to guide and support them, and the bed will move at a safe, comfortable speed. Ensure their feet are flat on the floor and well spaced, ready to take their weight. Then encourage them to take the weight in their feet. Use the controls to slowly raise their bottom up and reach the semi-standing position. This is a much less demanding height for the patient to stand from. As well as helping the patient to sit and stand up, as we have just demonstrated, some beds help you to roll the patient. If the backrest has an elliptical action, you can manoeuvre the patient to sit up in a chair position without pushing them down the bed. For this sequence, we will demonstrate the moves as if the patient is not in an electric profiling bed. They may be being cared for in a community setting and have a non-hospital bed, for example. Place a slide sheet under the nearest buttock to reduce shearing and encourage them to hitch onto their side, alternating shoulder and hip shift. Then remove the slide sheet. Encourage them by asking them to move their legs to the bed edge. Ask them to swing their legs down, pushing their top half up at the same time. Put on their slippers or sensible standing shoes. Some patients may be able to roll by pulling themselves across using a lever or egress handle that clamps onto the side of the bed or an inbuilt safety side. If you are using an electric profiling bed, the whole motion of rolling and sitting up can be assisted with the touch of a button. With the patient sitting up, support them on either side so they can put their feet on the floor. This move involves two nurses sitting on a patient's bed, so at this point you'll also need to think about infection control. Protect the part of the bed where you will sit with a clean towel or sheet, and then after use, put it in the laundry. We want to reduce the amount of contact between staff uniforms and the patient's bed sheet. Patients shed thousands of dead skin cells, and anybody who sits directly on a bed is going to take a large amount of DNA away with them and pass it to the next surface you contact. You can't use a disposable apron because they are slippery. For the purpose of this video, we have assumed the patient is not infectious and does not require the staff to obey specific infection control procedures, which would mean they were unable to sit on a bed. Now you are ready to assist the patient to stand and move to a chair. Sit next to the patient. Put your arms behind the patient's lower back, and then after the command of ready, steady, stand up together. You should be close to the patient, like in a close dancing position. If this is early days in mobilising from bed to chair, first practice the move by just standing up and then sitting down back on the bed. Check the patient's balance. If it's okay, now is the time to introduce their walking or balance aid. Ask the patient to step forward and then step back. Check their balance again, then repeat for the other foot. Walk or step sideways with the patient to the chair, and when you get there, turn with the patient so they can feel the chair with both calves. Then ask them to bow and sit at the back of the chair. They will have time while descending to reach for the chair arm, but we want to avoid a back bend. The staff member transfers weight at the same speed as the patient. If the patient is weaker on one side, ask them to move towards their strong side. If you're using an electric profiling bed, these movements can be made easier with the touch of a button. If you are working alone and the patient is not in an electric profiling bed, you can still help them to stand. I will now demonstrate how to do this safely. Please assume the bed is a standard non-hospital bed. I will assume you have spoken to the patient to prepare them, conducted a limb check and provided pain relief 20 minutes earlier if necessary. At each step, you need to explain to the patient before the move and give clear commands. Place a slide sheet under the nearest buttock to reduce shearing and encourage them to hitch onto their side, alternating shoulder and hip shift. Then remove the slide sheet. Encourage them by asking them to move their legs to the bed edge. Ask them to swing their legs down, pushing their top half up at the same time. Your hand connects with their shoulder to help with balance. Then ask them to put their feet on the floor. Check if they feel dizzy. If not, put a clean towel on the bed to protect it, and then sit on the bed beside them and support their upper body by putting your hand across their back to the opposite side of their pelvis. Position your foot that is farthest away, half a step forward, and turn your body towards the patient. You can now help them to get up to a standing position. Use the command, ready, steady, stand. As they get up, pivot to look towards them. Stay close to them, body to body, to support them. If it is helpful, you can introduce a stand aid at this point. As an alternative, if the patient needs some physical assistance, you can use a handling belt. These allow you to assist with moving while keeping yourself and the patient in a safe posture. Helping a patient move from a bed to a chair independently follows the same rules. They may wish to use a satin base sheet. This is a sheet that reduces friction and physical effort, and it's always on the bed, so you don't need to fit it in order to complete the moves. Patients can use these on their own beds at home, and that helps them independently get out of bed. Your role as carer is to guide with verbal instructions and to reassure. Also, you can do all of the necessary checks mentioned at the beginning of this video, including putting any necessary walking aids and furniture in a convenient place before the patient gets up. With a high rate of falls in hospital, remember to err on the side of safety. If in doubt, opt for hands-on assistance or a non-powered stand aid to help. So hopefully this has been a helpful run through of all the checks to make when getting a patient out of bed. Follow these steps and, most importantly, be prepared to stop if you feel the patient is in any danger of falling.